Imagine a patient comes in and says to you, I've got pain on the outside part of my knee. So medically we'll call it the lateral side, and we could try to simplify it if we want. So we could have pain where this X is on here, and this would be on the lateral femoral condyle. We could have pain on this other black mark, and that would be towards what we call the lateral tibial condyle. And this little mark is known as the Gerdy's tubercle, named after a French surgeon called Nicolas Gerdy. So we might get pain here. Let's say we get pain in between, then the pain is maybe what you perceive to be deeper. Then it might well be that you've got a tear of a lateral meniscus, but also it could be a sprain or tear of the lateral collateral ligament. The lateral collateral ligament is quite rare. More than likely you would have had impact from the inside, causing the knee to go into what they call a varus motion, where that ligament could be sprained. If a patient says to you, as soon as I run or contact the ground, it hurts on the outside part of the knee, then I would probably suspect more of a meniscal tear, especially if it happens almost like every time. More so as soon as you run in and you hit in the ground, where you have that compression coming through. But let's say, for instance, your patient likes to run, and then they'll say, I'm okay when I start, but around maybe a mile or so, 3 kilometers, give or take, a couple of miles, they might notice something on the outside part of the knee. So where he says, in this case, you might find the pain is around that lateral femoral condyle. And what you could do is a very simple test to try to confirm or deny your hypothesis. Because the condition, one calls it a runner's knee. The problem is with calling it a runner's knee is that if a patient says it hurts on the inside when I run, someone will say, well, it's a runner's knee. If it hurts on the front of the knee when I run, it's a runner's knee. So what we want to try to do is call it what it is. So this area is where the iliotibial band will come down from the muscle called the tensor fasciae lata, and as it crosses the lateral femoral condyle here, okay, it causes like a little friction. It's hard to say why, but what we might want to do is look at a test we can do to confirm it. This is known as the Noble test, and it's named after Chris Noble. And the idea is we try to mimic the motion of running, and then we try to mimic the symptoms the patient is perceiving. And it's quite easy, because what we're going to get the patient to do, they have a leg straight, and we are going to just ask them to flex and extend the knee at around 30 degrees. And then I'm going to place my thumb, let me just find where we are. So there's the IT band crossing, and I'm just going to place my thumb on there, and I'm going to apply pressure as my patient, off you go. It's hard to say how many times, just keep going. Keep going, maybe a little quicker, that's it, yeah. And then what you're trying to do is mimic. So if your patient says, that's exactly where I have my symptoms, then more than likely this test, so I'm applying pressure on the IT band over the lateral femoral condyle whilst the patient is flexing and extending. Okay, so once you confirm the presence of an IT band friction syndrome, and then you can maybe work out why, as in the cause. And typically some of the causes could be either the position of the foot and the ankle, okay, so you want to be looking here to affect this, or you need to be looking at the control of the glutes, and the TFL might be overactive, okay, maybe looking at the position of the pelvis, and there's lots of reasons why. So this is a symptom. Try not to focus all the treatment directly on this area. Try to maybe look at the cause, as in the why you get pain here, rather than just purely treating the symptoms. I hope you've enjoyed the video on basic IT band friction syndrome and the Noble test.